Well, on traveling down to California to have my procedure done, I must admit, I felt surreal. I felt it was almost like an out-of-body experience. How could I possibly think something as small as fixing a venous blood flow could make a difference in my illness? But I went in not expecting the world to change or shift. You know, Dr. Hewitt had outlined 3 things that he thought people would often gain benefit from. One was fatigue. Well, I had that. One was headaches. Well, I had that big time. And the other was, you know, issues of autonomic function, which would mean bowel and bladder control. So I had problems with that. And I said, well, if I get any of those, I'll be happy. I got them all. I mean, everything on the list of Ccsvi symptoms improved for me. So almost the biggest one, though, it was like a 15-year mental fog cloud lifted because my brain worked better. And to get that back was dramatic. Because I rarely shared this, my biggest worry with my MS was becoming demented. Because it happens to us 10 to 15% of the time. Pretty frequent. And I've had friends become demented. And I've had friends commit suicide because they knew they were starting down that road. And they'd made a pact with a friend that they would do it because they weren't going to walk there. Now I think my risk of dementia is much, much reduced. So that alone would be worth it.
Gianfranco Campalani is a high-profile heart surgeon in Northern Ireland whose career was nearly cut short by multiple sclerosis. Dr. Campalani became one of the earliest to try liberation treatment and was able to return to surgery.
I can stand with no problems for many hours. My energy level has improved. My right leg is not normal. I'm not talking about normality. I'm only saying that I was progressing, getting worse and worse and worse since 2007. That progression has stopped. And I hope it continues to stay there.
Dr. Campalani feels that denying patients a procedure as common as angioplasty because they have MS is unjustified.
I don't understand how they can sustain such a lie. Angioplasty is not the treatment of MS. It's the treatment of a vascular abnormality. And the citizen has the right to receive for free an approved procedure. That's all. In my hospital, they do 1,500 angioplasties a year. Well, it's a routine, everyday work. I think that to forbid it, to take it away, not to offer it to the patient, is a capital sin.